Hello, Assalamu alaikum everyone. This is Dr. Armish here. Welcome to another video tutorial in which we will discuss about how to do CPR or what is the procedure of a CPR. CPR stands for cardiopulmonary resuscitation. We use CPR when someone's collapsed and not breathing because it can keep people alive until the emergency services arrived. If you see someone or find an adult has collapsed, they would be in a cardiac arrest and you need to act now. Firstly, assess the person response. Assess for any sign of movement or a normal breathing. If the person have slow, deep gaps, this is not the same as breathing. Then call 911 or direct someone to call. Then start chest compression and use AED if available. Gently tilt the head back to open up the airway, then look, listen and feel the breathing. Do this for no more than 10 seconds. If there is no sign and symptom of breathing or if they are breathing in an unusual way, we need to do a CPR. So starting the procedure of a CPR, place the heel of your dominant hand directly on the center of the chest and interlock the finger of your other hand. Keep the arm straight and lean over the victim using your body to compress the chest. Push down the head. You need to compress the chest at least 2 inches and push 2 times every second or 120 times per minute. Then allow the chest to recoil completely with each compression. If the victim is on a surface like a bed or a couch, move them to the ground surface before beginning compression. You may have heard about mouth-to-mouth innovation. Mouth-to-mouth is not needed in this case. It may be needed for young children and infants. While performing the chest compression, direct someone or close by to get an AED. Now, what is AED? AED is automated external defibrillator. AED is only the thing that will shock the victim's heart to the normal function. When an AED arrives to the victim, simply turn it on and follow the voice, guide and instructions. That would be stay calm, detach the patch and attach to the patient's chest. Don't touch the patient during analysis of AED. Shock delivered, start CPR. AED will only deliver a shock to someone who needs it, so don't be afraid to put it on anyone who is unconscious, because any CPR is better than no CPR. So you will be the hero. Teach your friends and family to act now. Share this video with friends and family so that we all know what to do.